There we go. So good morning, everyone. And on behalf of Professor Rob Copeland and myself, I'd like to welcome you to this Easier to be Active webinar this morning. I'm Anna Lowe. I'm Programme Manager at the National Centre for Sport and Exercise Medicine in Sheffield. Today, we're launching our Easier to be Active resources, and we wanted to mark the occasion, firstly, by telling you a bit about the journey that we've been on to get to this point, and secondly, by taking the opportunity to say a massive thank you to everybody that's contributed to the development of these resources. It has been quite the journey, and we're so grateful for all the input that people have had that's really shaped the direction that we took with these resources. You'll hear a little bit more from me this morning. I'm then going to hand over to Susie Gardner from Sport England. That will be followed by Michelle Roberts from the Richmond Group of Charities, who will be followed by Dr. Catherine Homer, my colleague from the Advanced Wellbeing Research Centre at Sheffield Hallam University, who will tell you a bit more about the resources. We're not doing questions and answers today because of the volume of people we're expecting on the call, but there will be an opportunity to contact us later with any questions that you have. So if we could go on a couple of slides, please, Kath. And the next one again, thank you. So we started the Easier to be Active project 2 years ago, almost to the day. It's absolutely imprinted on our minds because there were some pretty significant world events happening at exactly the same time. So it's been 2 years of engagement and development and work on this project. And throughout that time, we've worked in partnership with Sport England, with the Office for Health Improvement and Disparities, and with the Richmond Group of Charities, and with a whole load of other partners and stakeholders. The problem that we've been exploring is the disparity in physical activity between those with health conditions and those without health conditions. So we know that in the UK, 1 in 3 adults has a long-term health condition. Those people with a long-term health condition are twice as likely to be amongst the least physically active in our society. And we know that there's a whole range of barriers that influence whether we're active or whether we're not when we have a health condition. And that many of those are beyond the control of the individual and actually exist within the system. And so we've tried to understand how we can get the system to work better for people with health conditions and ultimately make it easier for those people to be active. So I will hand over to Susie now.
Good morning, everyone, and thank you for joining us. I just wanted to take 5 minutes of the session just to set out why we at Sport England feel this work is so important. And I work in the health team at Sport England and focus a lot of my work around the how we embed physical activity within health systems, but also working with colleagues across Sport England to look at how we can all work to make it easier for people with long-term conditions to get active in a way that's right for them. And back in January 2021, we published our Uniting the Movement strategy and had subsequent implementation plans published towards the end of last year, but where we would focus our attention during 2022 and 2025. And this all happened after a period of significant engagement with partners and with individuals across a wide range of sectors. And I'm sure some of you that are on the line today will have contributed to that. And in the strategy, we clearly set out how we wanted to work collaboratively to tackle inequalities and make sport and physical activity a normal part of life for everyone in England. And we know that it's not a level playing field. And things like your background and your bank balance and whether you have a health condition and what your health status is, all can impact on people's ability to move more and to reap the benefits of that. And we are determined to work with partners to tackle that. And the Easier to be Active research across the last 2 years has been feeding into the thinking and the development of both the strategy and our implementation plans. And what it's ensured is that the voice of those with lived experience of health conditions is strong within what we're hearing and what we're listening to here at Sport England. And also that the voices of those working to support people with long-term conditions has also been heard in the wider strategic work that we've been doing. And I hope that as you read the resources that we're launching officially tomorrow and a sneak preview today for people on the line, that as you read through that, you'll clearly see how sort of the synergies between what's being said in Easier to be Active and our strategy and our implementation plans. and that it will really support us in delivering our vision and mission set out in the strategy by challenging the status quo and providing solutions to the systemic challenges that's been identified during the research and the co-design phase of this work. So whilst this work has kind of been led by the health team working with the National Centre for Sport and Exercise Medicine and the partners that Anna set out earlier, there are obvious synergies because of that with our connecting health and wellbeing ambitions that are set out in our strategy. But the findings of Easier to Be Active and the implications for the solutions that are developed through this co-design approach about how we better support people with health conditions to move more reach across all 5 of the big issues that are in our strategy. And so there are opportunities and challenges for us to consider tackling across the next decade. And these are set out in the next slide just as a reminder of the 5 key areas that in the Uniting the Movement strategy we say that we will be focusing on with our partners. And Easier to Be Active helps us particularly deliver on our Going Where People Are commitments in our implementation plan by providing us with understanding of those systemic challenges that people with lived experience told us they experience when they're getting active. And the findings and the work that we are launching today and tomorrow provide practical co-created solutions to do just that, and to challenge that status quo, and to ask us all to consider how we might change things in the way that we do things through our own practice and in the journeys that we're taking around activity to help make it easier for those of us with health conditions to get active and to stay active. And we'll continue to consider the findings of this work and the co-design solutions with our partners as our implementation plans continue to develop. And I think it's just really important to highlight that Easier to Be Active doesn't sit alone as a resource to create change and to make it easier for those of us with health conditions to get active. It sits alongside other programmes of work that look at tackling inequalities. And so these are just some examples of that. So it sits alongside the We Are Undefeatable campaign, which I know Michelle will touch on, which is really designed to support and empower people with health conditions to get active in a way that suits them. So it's really looking at some of those, the more individual barriers and how people are thinking and feeling about moving more with the condition they have. It links to the consensus statement of risk that was published back in November 2021 by the Faculty of Sport and Exercise Medicine, which really supports healthcare professionals to give high quality advice and support to patients who are concerned about exacerbating their symptoms if they were to get active, and to really get under the skin of that perception and where risk may lie, or the fact that actually it's incredibly low risk and it's safer for people with long-term conditions to be physically active. It also links to the work of the Richmond Group that I know Michelle will be touching on, particularly their Movement for All programme. It also links into the work of CIMSPA on the workforce standards and the right touch regulation to ensure that our workforce is high quality. It links to our work on moving healthcare professionals that we do with OHID. It links to the work around our local delivery pilots, and also the work with the Chartered Society of Physiotherapies around how we support people to understand the strength messages and how strength and balance could play an important role in the way that they choose to move more. And it also links to the work that we do with our active partnerships around creating change and challenging these systemic barriers. And so I hope you can see there how these things start to layer up and provide the really, really powerful way of supporting people to get active when they have a health condition by looking at lots of different barriers and lots of different solutions to creating that change. Thank you very much for giving me the opportunity to speak, and I will hand back to Anna.
That's brilliant, Susie. Thank you ever so much, and really great to see the synergy there between the Easier to Be Active resources and everything else that's going on at the moment. So I will hand over to Michelle now.
Thanks very much, Anna, and I really appreciate you inviting us to take part in this today, because as Susie's already said, this is something that's also really important to the work that we're doing at the Richmond Group. And just to let you know, I'm Michelle Roberts, and I'm the Physical Activity and Health Programme Manager for the Richmond Group of Charities. So I lead on all of our work supporting people who have multiple long-term conditions to move a bit more. If you move on to the next slide, please. Before I get started, there may be some of you that aren't necessarily familiar with the Richmond Group of Charities, so I just wanted to give you a really quick kind of introduction to us. We're a group of health and care charities that work in collaboration, and our kind of goal is to basically support people who have multiple health conditions to get access to the care and support they need, whatever that looks like, and wherever they live in England. So we're particularly focused on people who have multiple long-term conditions, and we're interested in thinking about sort of health inequalities as well. So there's a really sort of meaningful intersection with the physical activity work we do. It really kind of draws all those things together, because there's so many people that live with multiple health conditions, between sort of 15 and 30% of the population in England. So it's really relevant for us. And the physical activity work is a collaboration that's kind of goes beyond our Richmond Group members as well. So we work with the MS Society, Mind, Parkinson's UK, and of course with Sport England to help us to deliver that. And it's so important for us to just think about those kind of barriers and motivations that people have. And those are the sorts of things, obviously, that we highlighted through the Easier to Be Active work. And it really helps us to think about how we can kind of change the narrative for this sort of big population group of people and help them to start thinking about how they can move more in a way that suits them. Next slide, please. So just to really briefly explain what our physical activity work looks like, we've got a programme called Movement for All, as Susie mentioned, and ultimately that's been a programme where we've had a community of practice of our charity partners that have been meeting over a number of years, and we've delivered a number of different insight and delivery projects that have really helped us to explore how people with long-term conditions can be active, and what some of those barriers and motivators are that will help us to support them to be active. We've had a shared evaluation, so all of those kind of different projects I just mentioned, we had a kind of a shared evaluation framework, which meant that last month we were able to report on the last few years of monitoring of those kind of projects and the synthesizing of all of the insights. So I would recommend you to kind of take a look at that Movement for All evaluation report. There's some really useful nuggets in there. We've also been developing some other projects, so I hope that you'd be familiar with the We Are Undefeatable campaign. And that's very much a campaign that's focused on supporting people with long-term conditions to find a way to move more that works for them. So it's really focused on sort of telling the stories of real life people that have long-term conditions and how they've overcome some of their barriers in order to be active. We've also, alongside that, we've created a number of different resources to support people. So there's lots and lots of tools on the We Are Undefeatable website, but we also created some Make Your Move videos, which were tailored to people who have multiple symptoms. Because it felt like there was, whilst there's quite a lot of videos out there, they're often sort of tailored to people with single sort of conditions, and we just wanted to make it as easy as possible for people to get active. And also those videos are available offline as well, so that we're sort of reaching out to people who may be digitally excluded as well. So the last thing that we've been working on is an information resource pack, which is all about physical activity and long-term conditions. And we're really excited that the Easier to Be Active resources are being launched, so that we can include that in our resource pack, which we hope will also provide a little bit more kind of context around physical activity and long-term conditions. Next slide, please. So I've mentioned the We're Undefeatable campaign, and to kind of give you a sort of a sense of physical activity and long-term conditions and why this is also important, I thought it's actually a really great way of explaining this is through one of our We're Undefeatable ambassadors. So you're going to see a quick video which is telling you John's story.
I wonder whether we might have had a tech fail with the sharing of the video. We knew this one was going to be tricky, didn't we? Do you want a couple of more minutes, Kath, or do you want to move on?
Parkinson's is a very powerful condition. The frustration is massive. Yet when I see a football, it takes me back 20 years. My wife, Tracy, gives me everything that I need. She's given up an awful lot. I'm lucky, but I know that there are people who sat in a dark corner for a long time. The importance of having a support network can't be underestimated. We set up our weekly game between the Parkinson's guys and the stroke recovery team. This group has been a ray of light shining in their life. We want to put the smile back on faces of people with Parkinson's and remind them that there's still a life to live. Steve, relax. You're not wear shaky at the back though, so and we just look forward to people joining us to come and share our better life with Parkinson's. Good one. When you're ready. It's not the end, it's just a different beginning.
What's the easiest way to get in touch?
Thanks very much for sharing that, Kath. And I hope everyone agrees that it just really brings to life why we do what we do. It always makes me smile at the end of that video. Essentially the role of the Richmond Group in the Easier to Be Active work has really been about sort of helping to support, because it is obviously such a fundamental interest to us. So we've been part of the steering group, for example, and we've also taken part in the consultation and encouraged our members to use their networks to try and reach out to as many people as possible to take part in that, including people who have lived experience as well. And we've also included some case studies from the work within our members in the resource pack that you're going to get to see as well. So it's been really sort of, as I say, quite an important sort of like piece of work for us within our programme over the last few years to support this. And one of the things that we're looking at sort of moving forward, as I mentioned, is how do we kind of signpost to these resources, because they're so helpful for us and the work that we're doing in terms of making sure that it's sort of building on the rationale and the evidence base that we have and all of the insight we have as well. And it's providing some really practical examples for how people can support people to be active in different ways, kind of whatever your role is in supporting people. So in terms of how it helps us, as I said, it really builds on the existing research and insight, not only that we've already been gathering as well, but that others have gathered, and it just kind of helps to bring this together. And I think for those of us, working to support people to be more active, it just helps to make the case stronger and more credible. It really does chime with all of the existing kind of insight that we have, and we've gathered quite a lot through our work, in particular through our member charities and through the We Are Undefeatable campaign. So it's really great to have these kind of rich insights to add to that. It also, what's really helpful is the sort of how it distills the learning into such a simple framework that really makes it easy for us to engage with the research as well, and providing kind of real life examples of the resources to demonstrate how to use it in practice. So it's really fantastic for us. We're really excited to be able to use that. If you want any more information about us, you can get in touch. There's our website, the We Are Undefeatable website as well, and our emails. So thank you so much for inviting us to take part and for delivering these fantastic resources.
That's great. Thanks ever so much, Michelle. And it's lovely to see the comments in the chat there about the video. I think they have been universally really appreciated, haven't they? I've lost track of how many times I've pointed people to those videos. They're absolutely brilliant, really inspiring. So I will hand over to Catherine.
Hi everyone, and thanks for joining us today. So I'm Catherine Homer. I'm a Senior Research Fellow at Sheffield Hallam University in the Advanced Wellbeing Research Centre, and I've been part of this work, working with the different partners and many of you that are on the call today. So thanks for joining us. I'm just going to talk through, and just a bit of a reminder in terms of what we did throughout the programme, what we found, and just to tell you a little bit about the resources that we'll be able to share with you following today. So first of all, just a reminder, and Anna and Michelle have touched on this, I'm just going to say it again, kind of why we were doing what we were doing and what we set out to understand at the beginning of the programme. So we wanted to understand what was needed to create a frictionless experience for people with health conditions, and that frictionless experience could be travelling between different parts of the system, from health through to physical activity, through voluntary sector. It could be a range of different pathways throughout, but we wanted to understand what a good experience would be. We wanted to explore what high quality physical activity experiences look like, and we wanted to involve the wide community of stakeholders in exploring that, and that's why many of you joined us, and we're so thankful for your involvement in helping us do this. We wanted to generate new insight and recommendations for many of you who provide, who do, who design, commission physical activity and healthcare services, or those of you that are involved with them as a service user, and we wanted to kind of get insight from you as well. And we wanted to explore what's needed to improve the interactions that people have between with health conditions across the sport and physical activity sector, and finally to co-create the guidance that we'll share with you today on how to make it easier to be active with a health condition. So what we did, and I guess these are the areas that one of these areas, or more than one, will be what many of you were involved with and supported us with. So as Anna said, it started just as we went into lockdown in March 2020, and it ran through till June 2021. We did 3 phases of activity, the first one being an online conversation, and this was targeted at anyone that had got a health, identified as having a health condition, or anybody that supported or empowers people to be active. Within this phase, we had 350 participants. This was online, and this was supported by a partner, Clever Together, who's set up the systems and allowed and supported with this part of the data collection. And essentially we asked 3 questions here. We wanted to explore what could be done differently to make it easier to be active with a health condition, how you or your organisation have succeeded in making an impact in this area, and because of the timing when it went out, we wanted to understand how people were adapting their own physical activity behaviours or their physical activity offers during the COVID-19 lockdown. The benefit of having this online workshop that we used in phase 1 and then again in phase 3 was it allowed participants to have 24/7 access. Now, certainly during March through to May 2020, many of us were working all different types of hours of the day, and that really helped actually, because it allowed people to engage with the programme at different hours around your working lives at that time. It was always anonymised, and people could read, comment and vote on other people's ideas, and those ideas were judged on quality, not who said it. So as it was anonymised, that was really important. And we also felt that it provided that safe space for people who maybe in a room wouldn't feel comfortable speaking up, but online they'd allow themselves, they'd kind of that quieter voice would be heard. So that was phase 1. We then went into phase 2, which we delivered during November 2020 through to March 2021. And this was a series of in-depth interviews and focus groups. We did this with 6 stakeholders from 23 organisations across the UK. And here we wanted to test and validate the findings that we'd heard in phase 1. And we also wanted to identify if there were any gaps that were missing from the themes that we'd heard. And we focused particularly here on the impact of health inequalities on the areas that people had shared with us in phase 1. And then finally, in phase 3, which ran from May to June last year in 2021, that was the second national online conversation, again delivered with Clever Together. And that was to check and refine the themes that we'd heard in phase 1 and 2. And this time we wanted to focus a little bit more on how we could make it easier to be active. So 1 and 2 was more about the what would make it. This was how we kind of turn this into the how we could make it easier to be active with a health condition. In this phase, we had 246 participants. Pleasingly, 239 were new to the conversation, so we were getting new ideas here. And even more great to see was over 50% of these participants had reported being affected by a long-term health condition. That might be with them by themselves or by as they were a carer for someone with a long-term condition. So it really helped kind of explore the lived experience voice within that stage, which was great. So a bit about what we found, and this is really what we're here to present today, and features heavily across the resources that we've developed. So there were 5 cross-cutting themes that were identified from phases 1 and 2 of the kind of the engagement process. And these high-level or conceptual themes emerged as important areas that might influence the experience of physical activity for those with long-term health conditions, And by considering each of these 5 I's when you're planning, designing, delivering activity, or even taking part, the hope is it'll make it easier for people with long-term conditions to have a positive experience. So the 5 I's, we've got individualised, and by this we're just essentially meaning put the individual at the heart of everything we do, acknowledge and understand that where the person's coming from, can map their personal journey and goals, and provide support that's specific to their needs and preferences. We talk here about integrated, so ensuring that people with health conditions are connected with the right support and information, working together across different stakeholder organisations to share knowledge, best practice, and that best practice to be shared at a local level, a regional level, and a national level, and that came across as really important. We talk about influencers. There are a range of people that influence your ability and desire to be active, and I think that came across in the film that we saw through the Richmond Group, and that's why there is so much synergy between the 2 pieces of work. And these influencers might be people in healthcare, they might be fitness professionals, physical activity professionals, or an individual's own social and support networks, such as family, friends and carers. We talk about inclusive. The physical activity workforce is representative of communities, and those of us with health conditions. We think about inclusive marketing that uses languages and images that we can relate to, and that's where We Are Undefeatables has been really, really great and offers to remove barriers to get involved. And then finally, informed. So about helping people with health conditions to be better informed about their options, how they can be active, help other professionals to be informed too, so they can advise and support them and be informed about their condition as well. So they're the 5 I's that we've created, co-created obviously with everybody. What I'm going to do on the next few slides is just to share a few quotes, just to kind of show you where these themes came from and the types of things that you were telling us throughout phases 1 or 2. So this quote here includes many reasons why a person-centred, individualised approach and adapting the needs of individual is crucial. I'll just read these out. Just to make sure everybody's got them. So here somebody said, rather than just understanding, but sticking with rigidity, there is a need to adapt the exercise training, whatever, so it is manageable, enjoyable, and doesn't cause further pain. Work with the individual with whatever condition they have, listen to them and trust what they are saying, finding appropriate adaptations, reducing fear, increasing trust, and finding exercise which is achievable, realistic, and empowering. We'll just go on to integrated. So here we've got an example of what integrated could look like, and encourage the use of GP surgeries as a safe space. So running a 12-week programme in GP surgeries where the space is shown to be an effective way to introduce exercise to the hardest to reach people. Once they've experienced the benefits in a safe space, they are more likely to go on to join community classes. Got influences, so as I said, influence could take the form of many roles, and here's someone talks about the important role of carers. So I don't think that carers are really seen as part of the team. For example, why shouldn't the carer come along? It would make the person more comfortable, and it would educate the carer about exercise so they could continue some exercises at home. And then the offer and promotion around inclusivity was considered to be important, and here we've got 2 quotes talking about the sports groups and activities that are inclusive and open for people with all abilities, and it needs to be clearly advertised so people can feel confident in joining. And I guess an expansion of that is that the imagery that's used here, it's cited as leisure centres, but I think that cuts across many organisations, and kind of the imagery that's used. So we need to start focusing on this. So many images are still young, fit, lycra clad, and no ethnically diverse populations. And then finally, informed, so the type of information required by both the person with a health condition and the physical activity professional needs to be recognised to help the individual be comfortable in taking part in physical activity and talking about physical activity. It's about understanding what information needs to be passed to the person with the long-term condition, but also to the person that's supporting them to be more active. So we just wanted to share those to give you a flavour of what people were saying and kind of how we came up with the 5 I's. There was lots and lots more information like that, and all the reports with more quotes can be seen on the website as well, that we'll share with you after today, so you can see a lot more of the detail that's helped us inform you to get to the point of these resources. I'll just flip now to the next bit, and this is the bit that came out of phase 3, and this was the how. So how the sector can change. And when we're talking about sectors, we mean health and physical activity sectors. So all these 4 areas that we'll present now are informed by the 5 I's, and they cross-cut throughout. So we're talking about support, and I guess these are practical ways in which we can operationalise the 5 I's. So in terms of support, ideas were around co-creating the journey to be more active with people with long-term health conditions and professionals. So this co-creation is something that kind of needs to carry on through. So obviously we've done some of it here, and many of you are doing it all the time. It's just kind of give that importance to give the voice of people with long-term conditions, give them a voice within the work that you're doing. And peer-to-peer support, so using buddying approaches or social opportunities, which again was highlighted in the film that Michelle shared. Accessing activities, so provide evidence-based, individualised and inclusive opportunities to ensure that a person can make the choice of an activity that suits them. And access spans, to access as in physically getting there, to having the activities that are available for them that they're interested in taking part of. Access can mean many things, but just highlight kind of the individualised and inclusive opportunities. And we talked about strengthening the system and this building an inclusive workforce, and an inclusive workforce being people with health conditions, people that are representative of people with health conditions, or different people across society, and providing training and networks for people to learn, connect and communicate to better support. So networks across different organisations and stakeholders. And then finally, communication. So marketing using inclusive language, imagery and modes of delivery, highlighting the benefits of physical activity, and broaden that definition of physical activity. So we all understand what physical activity can be, whether that's gardening through to more structured exercise, and about creating searchable resources for activity opportunities so people can go out there and find what they're looking for quite easily. So that kind of shares the what and the how that we've kind of co-created with everybody. And what I'm just going to show you now is the resources that we've been able to pull together from that. All these resources are there for you to kind of just get information and ideas from, and it's just to highlight in a little bit more detail what we've done to show that it has been a co-produced process, and also kind of some ideas. And Kate, so we've got four resources on the website that you'll be able to access. We've got the executive summary. What you did tell us when we were going through the process, because we did ask what people wanted at the end of this process, and you said that when we shared the findings, you didn't want a lengthy report, and that's fine, because the lengthy reports sometimes can go out and then sit in your inbox when you've got time to come back to at some point. So we've kind of tried to divvy it up a little bit for different wants and how people take on board information. So we've got the exec summary, which is very simple. We've got the 5 I's framework, which just explains a little bit more about the 5 I's and what that might mean. We've got anybody that wants to read it in more detail. We've got the research summary and some recommendations at the end of there. And then we've also spoken to 5 different organisations across the UK to kind of share how the 5 I's are already implemented in practice. And many of you might know some of the organisations that are involved in that or do something similar already. I guess it's important to say that none of this is anything probably new to what you're doing. It's just a way of kind of pulling it together and maybe reminding people what could be considered when planning and designing activity. And the final resource that you'll be able to access is just this animation that I'll share now. So it's just a few minutes long to kind of explain the process that we've gone through and what we found, and give some real life examples of that.
1 in 3 adults in England live with a long-term health condition, and those of us that have one are twice as likely to be physically inactive. Supporting people with long-term health conditions into activity is critical to improving health, symptom management and well-being, reducing inequalities and increasing population physical activity levels. How can we make it easier to be active for those with long-term health conditions? Let's explore Sarah, Ian and Narinda's stories to find out. Sarah has arthritis, which causes painful joints and makes moving around a challenge. Ian experiences anxiety and low mood, and doesn't really have much social contact and often feels lonely. Narinda has gained weight during the menopause. and after a routine health check has found out that she is at risk of developing type 2 diabetes. They all have concerns about becoming more physically active. For Sarah, she's worried that movement might make her pain even worse. For Ian, he's lonely, unsure where to start, doesn't know what activity might help, and doesn't have anyone to go with him to keep him motivated. Narinda feels fitness class adverts don't include any people that look like her, so she'll be self-conscious, and even if she did want to go, how would she get there? But there is help out there. Sarah visits her GP and explains that she'd like to be more active but needs some support. Sarah says that she always used to enjoy aqua aerobics. Her GP explained that physical activity is safe, and exercising in water will help her joints and improve her mood too. They put Sarah in touch with the local leisure centre. The receptionist tells her all about the class and what to expect, including the name of the instructor, the amount of change she will need for a locker, and how to get there. She attends the class the following week. She was welcomed by everyone and was pleased at how easy the instructor made it for her to participate at a level that worked for her. She met other people with long-term health conditions there who encouraged her to come along again. What about Ian? He chats with a social prescribing link worker who looks at the menu of local opportunities and suggests joining a weekly walking group. He could meet other people who understand what he's going through, enjoy the benefits of being outside in nature, and get fit at the same time. Ian contacts the local walk leader and met him at the next session. He loved being in the woods, but most of all loved connecting with others and how much better he felt after walking and talking with them. He's buddied up with another person who keeps in touch, helps him feel less lonely, and supports him to attend for the rest of the month. And how about Narinda? She chats to her friend about her worries after a doctor's visit and how she could get active again. Her friend reminds her how much they used to love playing netball together and suggests they try a walking netball session at the local sports centre. The advert looks interesting. There are lots of different class times available, and on the flyer it looks like there are different women of all ages. Her friend says it could be fun and a way to get fitter too. They give it a go. Before the session, the coach asks both women to tell her a bit about themselves and talks to them about any possible health issues and injuries. Narinda and her friend were both a bit rusty. They enjoyed it and felt energised afterwards. They commit to going weekly together to improve their well-being. What can we learn from these stories to make it easier to be active with a long-term health condition? For people to engage in physical activity, activities must be individualised, inclusive, take into account influences, inform people of the benefits of physical activity, and be integrated into wider support for people with long-term health conditions. This is backed up by recent research from the National Centre for Sport and Exercise Medicine, who heard from hundreds of people who support others to be active, and also those with long-term health conditions across the UK. Participants came up with these 5 I's as the most important factors shaping a positive physical activity experience. There are lots more journeys like Sarah, Ian and Narinda's. Use the 5 I's to design, develop and deliver interventions that will make it easier to be active with a health condition. To find out more, visit the link below. One in 3 adults in England.
Okay, so that clip will be available on the website, but it'd be really great if any of you that use social media or your own work could help share that and signpost people to the website so we can spread the word and get more people involved in looking at the resources that you've helped us co-create. So I guess finally, we'd really like you to kind of go away from this today thinking about the implications of the findings for your own practice or your own physical activity journey. Just some questions on there that could perhaps help you get started, because sometimes when you get a resource like this, it's a bit of a, what do I do with it now? And maybe these questions will help you to kind of go away and think about that. So finally, just again, thank you to everybody that involved in helping us get to this point, particularly all of you on the call today and many of your other colleagues and many of the ones that we work with, and also Dr. Martin Lamb, who helped with us to do the phase 2 and phase 3 of the piece of work. I'll just hand over back to Anna to finish off.
That's brilliant, Kath. Thanks ever so much. So I'll just reiterate what Kath said. Thank you to Susie, Michelle and Catherine for presenting today and for talking us through the background and the journey that we've been on in developing these resources. A massive thank you to you for joining us today, and particularly to those of you on the call who contributed to the development of the resources. It's been really lovely to look through the list of participants today and recognise so many names, and to see such breadth in the audience as well. I know we've got people from charities, from national governing bodies, from research organisations, and from provider organisations, and a number of other institutions as well. So thank you for joining us. Our ask of you is that you access the resources tomorrow and afterwards, and that you use them to stimulate debate and reflection amongst your teams and in your workplaces, or with your colleagues and friends, and really think about how they might apply in your own context. The 5 I's are very high level themes, and they can be applied, I mean, different things in different contexts. So we really want to ask you, what does this mean to you? How might it stimulate new conversations, and how might it set things in train for change that ultimately results in it being easier to be active with a health condition? As Kath mentioned earlier, we heard loud and clear through the engagement process that people don't want lengthy reports. We have done those lengthy reports because we can't help ourselves. They are on the website as well, but we have really worked hard with partners to translate that and to create some really accessible resources that are meaningful to stakeholders right across the sector. So please access the resources, use them, help us to share them. We'd love to get any feedback from you. That brings us to a close for today. So I'll say a final thank you, and I hope you all have a lovely day.